So my name is Amanda Alvarado. I am a clinical assistant professor at the University of Texas. I'm the program director of the Acute Care Pediatric Nurse Practitioner program, where we teach students how to become acute care PNPs. I think back to my professors who I try to emulate. One of my professors taught patho, and each day she had a different prop to teach a different aspect of pathophysiology. One, we couldn't enter the classroom without a scratch-off lottery ticket that she would make with a psych pop quiz. I think we got to do all different things to keep the students captivated, and so that's my goal. And so I really enjoy that creative aspect. I also enjoy the students, kind of seeing that transition of students to clinicians to colleagues is really exciting to get to be a part of. And seeing the students yesterday I consulted a student who I precepted a few years ago with a child who was in urgent distress, and they were the consulting service who got to come in and do this incredible job taking care of this patient. And so kind of getting to see that on both ends is really exciting, and I just feel proud to be a part of it. I can't imagine being a clinical nurse educator without being a clinician. For me, those two parts are so intertwined that it just seems one without the other doesn't seem complete. So I work in pediatric congenital heart surgery and in the pediatric cardiac ICU, and so much of what I do is changing on a day-to-day basis, and so I feel like I need to be in there and able to keep up with the changes so I could then teach that to my students. So many of the things that I'm seeing in my clinical practice, we then get to bring to the classroom and have these discussions, whether it's on ethics or mortality or clinical decision-making or problems or whatever it might be. It's these incredible kind of segues to deeper conversation with my students. I think the other part of that is seeing your professor in the clinical setting is so important, right? They see me as a teacher, they know who I am, how I teach, how I approach things, but seeing how you approach medicine and nursing and families, and seeing that kind of how you then put your teaching into action, I think is really special. My advice if you're interested in teaching is start, right? You're a nurse, so you are teaching. Whether you're at the bedside and you're teaching families, whether you're a provider and you're teaching nurses or other providers, or you're teaching dietary or whatever it might look like, you as a nurse, you are teaching. And so that transition to the classroom seems daunting and seems like such a huge transition and a big step career-wise, but I think it's important to know, while yes, it is a big step, you're doing it now. You're doing the work. You have this toolbox that you've been building and teaching and ways to teach since you were in nursing school. And so use that, build on that for something bigger.